are out there trying to continue to fill our kids with knowledge even when they're not in a school site. USDA is working very hard to continue to fill their tummies. You may know that many of these children receive breakfast and lunch at their school sites, and our federal government participates with our dedicated school nutritional and lunch professionals throughout the country, and we have issued waiver after waiver to make this flexibilities available for things that make sense when children cannot congregate in a singular location. That's one of the first waivers we issued, and when Congress gave us the authority to issue more, we are turning those waivers around in rapid speed, really less than 24 hours. So we're very fortunate that we've got a great team at our Food, Nutrition, Consumer Services team working 24/7 to make sure that our kids continue to be fed. It's a great partnership that's happening out there. I want to mention one other simple but very important point about another matter that your listeners and readers may be very interested in. That's the food supply chain. USDA obviously is intimately involved in the food supply chain. We've worked with all those producers, even the ones who provide equipment and materials for our farmers and cattlemen and producers out there to make sure they have what they need. They're part of the critical and essential workforce there to continue. And the good news is those folks are staying on the job. Those who've grown it, those who are processing it, our inspectors who are grading it just the same way they always had, those folks who are delivering it, packing it, delivering it, stocking those shelves, and checking out those customers. That's the great news about our food supply chain. And it's a great American story. Mr. Vice President, under your leadership, the President's leadership, this is that whole of America approach. Federal government can't do it all, but we got great partners out there in the food supply chain, as well as our food nutrition services and our partners in our school nutrition services doing a great job to continue to get these meals to kids there. Two of our private sector partners are here with us today. I'd like for them to tell their story because it's a great story. Denton McLane with McLane Global here has partnered with Baylor Collaborative on Poverty and Hunger, along with PepsiCo, in order to pack 1 million meals a week to deliver to rural kids who might not can get to town to these drop-off sites where the other kids are picking up meals. And again, Niren Chaudheny, Niren Chaudheny of Penera Bread, CEO of Penera Bread. Their company is also participating in Columbus, Ohio, with the Children Hunger Alliance there to deliver food meals that meet the regulations of USDA under flexible conditions there to get food meals there. And Panera is looking to expand that to nationwide as well. So, Denton, why don't you come and tell us your story? Thank you very much.
Thank you, Mr. President, Mr. Vice President, Secretary Perdue, and Secretary Voss. Right now, there's a lot of focus on our large cities and the enormous challenges that they face. But imagine this. You live in Iberia Parish, Louisiana, or you live in the Nome Borough in Alaska. Your schools are closed, and normally your children get 2 meals a day at school. Both parents are working from home, but mom and dad just can't get to town where meals are being offered for pickup. That's about to change, and change for the better. Because of this USDA program, McLane Global will source, secure, receive, organize, assemble, package, label, and then deliver boxes straight to a child's home. And here's another big difference. For the first time, we'll be able to offer shelf-stable meals that will last 2 weeks. That's a true game changer for rural families. It's happening because of the President's order to do whatever it takes to get the job done. Everyone knows that tons of paperwork can be like lighter fluid for a great idea, and this is a great idea. We field tested it in 2019, and it worked. You've heard today about the administration's work on this project. Here are some other important partners in this effort. We have Baylor University. They will provide sponsorship and oversight. In addition, we're deeply appreciative to UPS and the United States Postal Service, and we're joined by PepsiCo Company to help get this accomplished. Because of this collaboration and our tireless employees, I can report to you the boxes are ready to ship. And after all, this is all about the children who must be fed during this crisis. We stand ready to serve. Thank you, Mr. President and Mr. Vice President, for caring about the specific needs for the children who live in rural America. Thank you.
I want to welcome Niren Chaudheny, CEO of Penera Bread.
Good evening. Thank you, Mr. President and Mr. Vice President, for your leadership. It's an honor to be here, and I'm deeply grateful for the opportunity. This is an extraordinary time, and I passionately believe that at such times we must all come together and do our very, very best to contribute and make a difference. At Penera, our mission is simple. It is about ensuring that good food is accessible to everyone, especially those who are the most vulnerable, such as children, and especially at a time like this. And we are absolutely determined to make a difference in this regard. Today, we are announcing a partnership with USDA and Children's Hunger Alliance to serve freshly prepared, wholesome meals to children in the entire state of Ohio to begin with, and hopefully after that to expand that program across many other states in the country. I do believe that the human experience, indeed life, is all about having resilience in the face of adversity and also having the tenacity to just keep going, And at Penera, our associates and our franchise partners live that spirit every single day. They are resilient and they're tenacious. And on their behalf, I pledge that we are committed to do the right thing for the country and help serve those who need it the most at this very important time. We are ready to serve. Thank you very much.
Outstanding. Thank you so much. Thank you so much. Thank you for your business's incredible generosity. And I'll actually allow the two business leaders to step out if you'd like. We appreciate you so very much on behalf of the President and a grateful nation. Before we go to questions, I'm going to invite Dr. Birx and Dr. Fauci to step forward with a few reflections on what we're seeing in the data. And as you all are aware, over the next several days, our team will be assembling recommendations for the President to give further guidance to the American people, to states around the country, and they can both share with you the importance of ongoing efforts of mitigation by every American, the need to support what state and local leaders guidance is to every American community, but also as Dr. Birx continues to work carefully with the modeling, analyzing the data, she'll reflect on the progress we've made in that. Deborah?
Great. Thank you, Mr. Vice President. Just to pick up on some of the questions that you had earlier. So the issues that we discussed with the modeling yesterday was to ensure that the models were adjusted for the great work that every citizen is making in doing the mitigation efforts, and to see if that was reflected in the request specifically for ventilators. And so we wanted to make sure that with a limited number of ventilators and the issues that we saw in Detroit and Dearborn, in Cook County, and now in New Orleans, that we were balancing and projecting correctly based on both what the models had predicted and then whether they were adjusted for the incredible mitigation work ongoing in New York City. We understand that this week and next week will not reflect that mitigation, whether it's New Orleans or whether it's New York and the New York metro area. We know that the hospital admissions that we are seeing this week and next week will be infections that occurred before the mitigation started. But we wanted to make sure going forward that the needs reflected that. That was what was adjusted in the Ferguson model for the UK, and I know you're following that very carefully. They believe strongly that the mitigation methods that were put into place that informed our mitigation methods, we all were working off of that same model, and I want to make it clear that those models, those flu models, have been incredibly helpful to really predict what would layering of these different mitigation methods, from social distancing to staying home if you're sick, to staying in that household, to quarantine everybody in the household if anyone is positive. Now, there are other countries that took different approaches, and I want to be clear because we did hear from both China and South Korea. But it's always important that you adopt and adapt it to your community and the reality of your country. We do this around the world. You can't ever just take an off-the-shelf approach and then put it into action in your community. You have to understand your communities. And so although both China and South Korea removed people who were positive from their households and segregated them away from their families, we did not think that our Americans would adopt and adapt to that situation. And so that's why in our guidelines we asked people, if there is a family member, to try to self-isolate in the household, and so that that person is still there in the household.